disparities that Black women face, housing and food. But maternal health care is one that is very drastic when it comes to just the equality of services. A lot of Black women or Black moms are unaware of the sources and the resources and the tools and the just what you need in your maternal health care bag. If you're going to have a baby, these are the tools that you need. A lot of Black moms don't have it. And I have this organization because I want to see a decrease in the disparities that Black women are facing when it comes to maternal health care. Maternal health care, it should be for everyone. Good maternal health care should be for everyone. I mean, women are literally birthing the nation. You cannot come on this earth without coming through a woman, okay? So, because I am a Black woman, I am targeting other Black women because I want to allow them to relax when it comes to your maternity experience. I don't want you to be nervous and afraid and depressed during postpartum because you don't have anybody to come and assist you in your isolation, in your postpartum depression. That's ridiculous. That's what Melanin Mothers Meet is here for. It's all about assisting moms with their postpartum care, assisting moms with resources for prenatal, perinatal, postnatal, whatever language is best for you. We want to provide this service, this community of collaborative efforts, because it's not that I'm doing it by myself. Absolutely not. We need each other. Okay. And Melanin Mothers gives opportunity for those to use the services of each other's. Yes, I love this question. It's my favorite one because Melanin Mothers Meet wouldn't be without collaboration. Not one person can do the work that Melanin Mothers Meet provides to our community. Not one person can do it. It's not meant for one person to have a baby, okay? Now, it takes two to tango. We know that part. But it also takes the community, the village, to make sure this mom is raising a child that is also not mentally stressed either. Because if the mom is mentally stressed, then what you think is happening with the baby as the baby is breastfeeding, if that mom decides to, if she even knows to? If she even can, if she can, because everybody has a story, and what I've learned over the years, as humbly as I could, that every story doesn't look like mine. And everybody doesn't want my story. So it's good to be able to be in this field, and not with the what others would call going to get my PhD and all those types of things. After I left college, I went to Florida A&M University, and I have a background in psychology and social work. And I said what I learned from psychology and social work is that the community is doing really, really bad, and we need to get out here and start working in it, because if not, it's just going to get worse. So you know what? Go get your doctorate. I'm going to go out here in the community, and then I need you to come help me, and let's put this, information together so we can see what we need to do for the community. Because it's going to take both sides. It's going to take the doctorate, and it's going to take the community experts. So, and we bring that together to be able to accomplish the need. It's so simple. It's so very simple. And collaborating with M3, I can always tell this story. Tallahassee Memorial Hospital, they called me. They had a mom, Black mom, and she wasn't from the area. And I think she lived about an hour and a half, and I think her aunt was older. So she wasn't able to drive back and forth. And the mom also had a 1-year-old, or she was turning 1, but she wasn't going to see her because she was in the hospital. She was at TMH. So she wasn't going to see her. So she was with her aunt. So they connected her to me. And it was such an honor. See, what happens is, you know, with Melanin Mothers Meet, we get a lot of referral moms, right? So if someone knows about Melanin Mothers Meet and what we offer, and even if it's not a specific service that's needed, we listen to the mom, and the mom can let us know what she needs specifically. And then, okay, who out of my team of collaborators or partners can I call for her need? And so, we've collaborated with people like Capital Area Healthy Start. And Capital Area Healthy Start plays a big role in Melanin Mothers Meets, just connectivities and resources and things like that. I really appreciate Chris for just kind of taking me under her wing. And that's important with collaboration, because everybody's on a different level. When I partner with places like TMH, when they called me about that mom, it was very simple for me. It was very simple. What needed to happen next? I was like, wow. And then for it to be Towson Memorial Hospital, that was just one of those things where it was like, this is big business. You know what I mean? Like, this is my chance to show what we do every day. This is what we do. Okay. So, and this was around Mother's Day of last year. And we were able to get her everything she needed. I had moms to send her 1-year-old gifts for her birthday that was coming up. I had other moms to send diapers, clothes, wipes, whatever she needed. I wrote down, I did her evaluation. I did a consultation with her. She told me the things that she needed. I made sure that she was good in that space where people that I knew that worked there could stop in and take care of her, because that works in that maternal health space anyway. Maybe even on the same floor. You know what I mean? It's right there. It's right there. I even had a doula to come in and be her doula. And she did it for free. She did it out of the kindness of her heart. She did it. And I have to say my sister's name, Talithia Edwards. It's nobody like her. It's nobody like her. And I was able to connect with her and call her, and she got it done. And it was easy. It was nothing. There was no hesitation. There was no, I give you a call back. There's no, meeting after meeting after meeting. Okay. It was get the job done. And if we understood, and this is something I think everyone would like too, if we understood how much money collaborating could save us, okay? A little silence for the pause. When you say you want to help somebody, many hands make light work. Okay? Many hands make light work. So if we're really out here to help someone, those that are the content experts, right? And the context experts, those are two different types of people. And so we have to be able to adapt, to whatever is going on, because just because we're getting together with our buddies and we're talking about what we think the community needs, it could be totally different than what the actual community needs. But you don't know that because you haven't been in the community. How are you serving the community and you haven't even been in the backyard? It's very interesting how you are viewed as an executive director of anything. It's very interesting because it's automatically assumed, whether it's quiet or loud, that you have everything all together, your life is peaches and cream, you don't need any help because I see you doing things that I'm not doing, so you must be up there with them. And it's like, it's so funny because in reality, I'm over here like, but just to kind of give you the context of what it really could look like, and thankfully, I have mentors or advisors that help to guide me. You have to have that oomph to keep going, because it is not easy. It is not easy, and especially when you're doing it in a way, when you're running a business in a way that you're trying to gain more business. Problem solving is the biggest task that you have in running a nonprofit. And honestly, I would say funding, the finances, that has been the hardest. Now, it has never stopped anything. But what happens is, as an executive director, you will have adjustments in your life that you just have to adjust to. Like, you don't have time to like do what maybe somebody who doesn't have the same position running a business has to do. You know what I mean? You have to keep going. Maybe somebody passed in your family, and you have an event in 3 hours and you just found out. You may still have to show up at that event and do something. You know what I mean? And so it's I would say finances for sure. Just balancing the limited resources, with the growing demand, for our services. Because the more I stay out here, and I've been out here for 8 years, that just consistency is what I learned from advisors and people who look out for me. It's about the consistency. So we were recognized in the city of Tallahassee for Black Maternal Health Week by the mayor, Mayor Daley. And we also were recognized for Black Breastfeeding Week, which is in August, by Mayor Daley as well. So for Black Maternal Health Week, we usually do a number of things. This year, I'm switching it up, and we're going to do a ceremony. We want to focus the ceremony on community action and what they will do for Black Maternal Health Week to be a part of the work, right? And so that'll be a campaign that we'll have coming up, and we haven't put it out yet, but it's coming soon. Actually, and for this weekend, April 6th, we are doing our first annual Black Maternal Health Ceremony, and we are going to be speaking on postpartum social support and the importance of it. We'll have our keynote speaker, Dikebra Gaskin, and we're also going to be speaking on a launch that will be happening over this year, because we were awarded some funds for a project that Center for Thriving Communities helped us to receive. So we were able to win. I think it was 27. We did 3 out of 27 people were selected, or counties were selected in Florida. And so Melanin Mothers Meet in Leon County was one of those 3. So that's pretty exciting. So hopefully that'll be something good under my belt and bring me some more in. But the Black Maternal Health Ceremony, we'll dive into that a little deeper there. And we really want to target maternal health care agencies. So places like the Oasis Center, organizations like MAPS, organizations like Sister Friends of Tallahassee, maybe even the health departments, the WIC department, places like that, North Florida Women Care, things like places like that, organizations like that. I mean, even TMH. But just, we want to bring the healthcare agencies in, because we're also going to have the lived experience moms and the postpartum moms that have lived these experiences, right? And we want them to know that these agencies exist. Here they are. And I can't wait to tell more about what we're going to be, what we're funded for with the Equity Action Lab. And basically, I guess I can just, pretty much mention what that is, but it's when the context and the content experts get together to see what the need is. Okay, so we are looking for the diverse groups so that we can truly get to what's needed, because what a what an expert in the field where they've gone to college and those things, what they may think is the need may not be the need with the actual person in the community. Those are some of the things that we have coming up, and we're excited for its fruition.